Excellencies, ladies and gentlemen, I would like to extend my sincere gratitude to both Her Royal Highness Princess Dr. Nisreen Al Hashimite and to the Royal Academy of Science International Trust for the invitation to address this high level panel. I welcome the opportunity to help celebrate the silver anniversary of the first campaign, Health is a Human Rights, Right and Dignity. I equally owe thanks to the American University of Beirut, both for hosting this event and for its role in bringing students and young people's voices to the forefront of this discussion. I believe young people should be at the front lines of decision making. Indeed, youth empowerment is a cornerstone of my presidency, and I welcome any opportunity to engage. Excellencies, the right to health is a fundamental part of our human rights and our understanding of a life in dignity. This was first articulated in the 1946 Constitution of the WHO, where the preamble defines health as a state of complete physical, mental, and social well-being, and that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic, or social condition. At the same time, healthcare must be accessible for all sections of the population, including children, adolescents, older persons, persons with disabilities, and other vulnerable groups, as well as financially and on the basis of non-discrimination. Dear friends, the silver anniversary of RASIT's campaign takes place as we collectively strive to recover from the impacts of the COVID-19 pandemic. A pandemic that has shed a stark light on how underlying vulnerabilities and inequalities have only been exacerbated, leaving behind those most susceptible to its devastating effects. It has underscored that which we already know. The right to health is a fundamental right to all. Assuring this right means more than access to health care. It encompasses all the determinants for a healthy life, the right to access safe food and water, to health-related education, and to gender-based equality, amongst others. This is why this event and the work of Dr. Sukarriya are so critical. Their holistic approach values health as a human right, a necessity for all to live a healthy life. My friends, recovering from the COVID-19 pandemic is one of the 5 priorities, the 5 rays of hope of my presidency. This is why I organized the high-level thematic debate for universal vaccination in past February. This is why I have championed fair and equitable access to vaccines to each step of the way. This pandemic has set a challenge for reaching our sustainable development goals. However, my presidency is one of hope, and I am hopeful that we can seize the opportunity that this pandemic has presented to us, the opportunity to reset how we approach our objectives, the opportunity to rebuild more sustainably and more inclusively. We must commit to ensuring equality, accessibility, and inclusion in healthcare by guaranteeing a human rights-based approach to sustainable health. As we work to accomplish our SDG objectives, we as an international community need to act multilaterally to reaffirm the universal right to health. Together, let us work towards a just and inclusive recovery. Together, let us take this opportunity to redress the inequalities of our world. Together, let us make our world safer for all. I thank you.